Hi, I'm Dr. Adam Cross. I'm a pediatric hospitalist and clinical informaticist, and I'm also the lead of the Children's Innovation Lab here at JUMP. This lab is all about maximizing opportunities for children's healthcare innovation. It has to do with both innovating new ideas, but also finding ways to better utilize the resources we already have within our system. It combines idea generation within the lab itself with consultation with other members of the healthcare community. I hope to make meaningful advances in the way in which we take care of our children, both in the hospital and outside the hospital. I want to make a place where we have dedicated applications that are meant for our children first. And really, it's meant as a way to bring the technical expertise of all of the people here at JUMP over to the physicians who are in the children's hospital. We have a lot of bright minds in both places, but sometimes it's difficult to connect the clinical need to the technological outcome. So my job as an informaticist is to help to bridge that gap by understanding both sides of the equation. We're working on a vaccine project where essentially we're creating a heat map of under-immunized children that are within the OSF healthcare system and de-identifying them, but getting a sense of where these patients are clustered within the state based on zip code and school district and that sort of thing, so that our healthcare system can optimize its delivery of vaccination resources to the community as we go out and provide these tendrils of care outside of these brick and mortar walls of our institution. Ultimately, we're hoping after we create the model of our optimization process and the vaccine data, that we could partner with the Department of Public Health for Illinois and potentially make this a statewide thing where we take the statewide vaccine data and combine it with our algorithm to see statewide who is in most need of vaccinations, and using predictive model analysis, who is most likely to be under-immunized when their 9-month, 12-month, 2-year appointments come by, so that we can have these immunizations on hand in the appropriate locations to really make the best use of the resources we have. By providing friends and interactions in an augmented or mixed reality environment, I think our children will feel more connected to each other, to the creations that we provide. I think by having those kinds of conversations, we can really propel this lab and our technology and the care of our children forward in ways that we could never have done before.